in the chat, and then we know who we've got, and it doesn't feel like we're just talking to a computer screen. That would be lovely, and we'll keep an eye on that. So if you do that, I'll just run through the next slide, which is what we said we'll cover in the next hour. So as I've said, we're going to be sharing the learning and the resources that we've developed this last year under our DFE contract, pitched at different levels, different audiences, and we'll kind of talk you through that as we go. So some are practitioner focused, others are strategic level resources. Again, we'll talk you through all of that as we go. We'll cover what we've done, importantly, when it's available, if it's not already available, and where you'll be able to find it. And at the end, there'll be a little bit of time for some questions, reflections, and a brief kind of update on what this contract will look like next year. And it's nice to see lots of familiar names, lots of DCOs in there too. So that's great. And I think I'm going to hand over to Philippa straight away to talk you through the things that she's been leading on.
Thanks, Anna. I'm going to try the take control button and see if I can drive. There we go. So I'll start off with our e-learning. Now, I know our sort of big e-learning package on holistic outcomes in EHCPs has been around for a while now, and is actually being used really well and really widely. So do bear with me while I cover that quite quickly. If you've already seen it, used it, recommended it, please do keep spreading the word about any and all of these things. So during our sort of last year of work, and actually in before that as well, we've been delivering live workshops on holistic outcomes in education, health and care plans. They've been running very successfully for the last few years. But what we were finding was that despite the reforms having been in place for some time now, there's still sort of limited understanding around outcomes and what they really mean, particularly to children and young people. We found that there's, as you know, very high staff turnover, which means that organisational memory is being lost. And there's also been a real shift that I've noticed while we've been doing workshops over the last sort of 18 months, that there's now a real move from complying with that timeliness, that 20-week element, to really thinking about quality. So people are really wanting to understand what a really, really good plan looks like. So we're starting to see a bit more of a move into that, that deeper understanding. We also know there's still issues around communication sort of within and between agencies around the EHCP process. So it's still very much a need to sort of strengthen understanding around this process and how outcomes run throughout that. So we started putting together a package of training. Now, all of the training that I'm going to mention here, and indeed all of CDC's training, there is more. I'll mention a couple of pieces, but won't go into them in detail. All of our training online is available freely. At that link there, you will have the slides and you'll have links and things. So you're welcome to dive into that. It's self-guided, so you can use it whenever you like, wherever you like, with whoever you like. It's free. It is aimed at professionals, but it's open to all. There's absolutely nothing stopping parents and families accessing it, and we do encourage you to spread it as widely as you can. We sort of have different intentions for these modules. It's very much is an individual piece of learning for individual practitioners to increase their own understanding, but we also hope that people will start to use them as a way of sort of doing some individual reflection and then sharing across teams and within services, and even more widely thinking about how the system works and how different people play their role within that system. We do have the potential to offer additional support around this. We've had quite a few areas recently who've gone and done the e-learning and then brought us in to do some sort of facilitated conversations around where to go next and where to make progress around the challenges within the EHCP process. So that's something that we do offer. And again, so for all of the modules, I will mention they were sort of developed in a similar format. So we firstly identified a need in our wider work, as I've just mentioned, during live workshops usually, and then we pulled together a focus group made up of sort of relevant users, so professionals for whom the resources aimed at, and also parent carers and children and young people's perspectives as well, to draw the content together, building on sort of what we already have as part of our live workshops. And we build in existing resources and we make sure that there's a really good element of interactivity there. We know that online learning isn't for everyone, so we try and build in as much engagement as we can. So we have sort of a suite of resources around EHCPs, and we have the main holistic outcomes in EHCPs, which is our live workshop in a digital format. We also have good quality health advice, which I think is just in the process of being signed off and publicised. In fact, I think it's been signed off, but that sort of promo is coming out soon. So that's hot off the press, that one. I'll cover the content of that in a moment. Our colleagues in our social care team also have sort of a parallel mirroring set of modules around social care advice, and we're working on one around annual reviews in particular. So I'll touch on the content of all of these briefly. But again, if they're not already signed off, they will be very, very shortly and available for use. I think we can probably follow up with any updates to this attendance list when those are live and ready. And again, across that whole package, we make sure we pull on the legal requirements so people understand what that legal framework for that process, that particular element of the process is, roles and responsibilities of different practitioners, parent carers, children and young people, and how those interlink together, what good practice looks like and examples as far as we can. We have a real focus on the importance of the child, young person and family voice, and we've got some really nice quotes and comments and things from our FLAIR group and case studies of children and young people to really bring it to life. And that's one of the comments we've had a lot about these e-learnings, is they really do bring that voice to life. We ask you to sort of reflect and respond to case studies, but also give you real prompts and consideration to think about what you're doing in your local area and how you might do that differently. So the main package is a really broad audience. It's basically anyone who's involved in the EHCP process, including parent carers. So I won't go through that list, but it is a really, really wide audience. There are currently 6 modules, but that will go down to 5 once our annual reviews separate package is live. So there's an introduction. We then focus on the importance of aspirations and how we unpick a child or young person's aspirations. We then look at outcomes from that child, young person and family perspective. So what do they mean to that individual and how do we draw them out of those aspirations before we start thinking about what they mean from a professional perspective and what they mean within the plan. So we want to really centre it in that child and young person's viewpoint before we come around that with the professional elements. And of course, the legal considerations. So as I say, at the moment, there is an annual review module in there, but we've done some much more in-depth work in our new package. As I say, this is something that we either get commissioned, brought in to do a facilitated conversation around the process, and this is a sort of precursor to that, to get that good practice and that understanding before we start thinking about what does that mean in our local area. A lot of areas are building them into their staff induction packages, and that's going really well so far, and we've had some good feedback on that. But also people are using it as a sort of a quick introduction to those who are more or less closely related to the EHCP process, but do have some influence on it. So youth offending teams, fostering, portage, that kind of thing, to give them that awareness and that context for when they are involved in the process. And parent carers, as I say, are more than welcome to access it and increase their understanding of what a good process should look like. So that's the sort of broad one. And we then came and developed a focused one on health advice. We know that's an area that in need of some development in a lot of local areas. So this just drills down into that advice element more than is covered in that main package. So this is divided into 3 levels. The first level is for those who, similar to that previous audience, have irregular or infrequent contact with the process, but do need that broad awareness. So that might be things like diabetes nurses, and so on. So they just need to understand sort of what the context is and where advice fits into that process. Level 2 is for those for whom it's bread and butter, who are doing this regularly, and really dives down into what good quality looks like, and thinking about how we can really develop our own practice to support the plans as far as possible. And level 3 is for those with a bit more of a strategic oversight or some quality assurance roles, thinking about what a good process looks like as a whole, and how that can run smoothly and be really wrapped around the child or young person. I won't go into this in much detail because we've got a lot to cover this morning, but we start to think about in that level 1 again, as I say, the background and why we need advice and what the role of advice is, with a real focus on how advice acts as the bridge between the child's situation now and their needs and how those needs impact on them to getting them towards those outcomes. So our advice needs to be really outcomes driven and how provision fits into that. Level 2 is a bit more about the writing and what we want from a piece of advice, how we balance that sort of simplicity, but with the relevant details that we can have appropriate provision, but without it sort of being too jargon heavy or too intense for our plan writers and our families who are reading the plans, and sort of understanding the remit of the health advice giver when there are so many other professionals involved in this process. So it's just sort of thinking a little bit more deeply about what we want in our piece of advice. Level 3, as I say, is more about the process as a whole and how we can coordinate a nice, smooth process that brings everyone together. And has a bit of a think about quality assurance. So how do we quality assure that whole process as well as just the individual pieces of advice that we receive? So that's the health advice. And then the last thing that we've got, as I said, I mentioned there is a sort of parallel social care one, but that sits with another team, but we can include links to that. It's all in the same platform. So if you want to share with social care colleagues, that is very much available. So annual reviews. This is 4 modules and is aimed at, again, it's quite a broad base of people, anyone who is involved in that annual review process in whatever way, as an advice giver, as a host, and as a parent carer. 4 modules, as I say. So the first one is about the importance of the annual review, not just as a legal requirement, but also what it really means to children and young people and families from their perspective. Second module is around the sort of the statutory ins and outs of the process and the legal requirements. The third module, I think, is the one that people are really interested in and really excited about. This is what a good quality annual review, how an annual review meeting, or how we involve a child or young person who is not attending that meeting for whatever reason, because they choose not to, because it's not appropriate or it's tokenistic for them to do so. And this draws really heavily on the input from our FLAIR Disabled Children and Young People's group about what they want from their annual reviews, that they want them to be empowering and exciting and positive. And they've given us lots and lots of suggestions and ways that professionals can support them during that annual review process. So that's a really, really nice child or young person led module. Then we've got module 4, which is about preparing for adulthood and the additional considerations for year 9 and beyond, which has been put together by our colleagues in NDTI who are leading on that strand of this programme. So as I say, these are just coming out any time now and will be available very, very shortly. That's the e-learning. There's much more on our platform. You're welcome to go and explore and dive into whatever you want to. As I say, it's free, self-guided, so do take the time to look at that when you are free to do so, and we'll share the link for that. But the next resource that I'm going to talk about is about our Outcomes Explainer document. So these aren't e-learning, these are PDF resources. So these came about, again, identified during our live workshops as a sort of common need. I've already mentioned that understanding about outcomes in their fullest sense is maybe not quite as strong as we would like it to be this far into the reforms. So again, it addresses that understanding, but it thinks about outcomes in the broadest sense, not just in that individual level, but looking at the operational, the service levels and the strategic levels, and what the relationship between those are. So how we understand our sort of system through an outcomes-based lens the whole way through the system. The other thing that we're finding from local areas is that there's a huge move towards this outcomes-based approach now, and a lot of enthusiasm around it. We're working with a lot of different areas on getting an outcomes framework together and thinking about how they're commissioning and delivering pathways and so on in that outcomes-based way. And one of the things that we found that they really needed was a resource to help them communicate this new approach, what it means for practitioners, what it means for professionals, and what it means for families to be part of this journey towards an outcomes-based delivery. So this resource helps to do that. We also find there's a lot of confusion around vocabulary and terminology when we're talking about outcomes, so it just iron some of that confusion out a little bit. We've got two different documents. The first one is aimed at parent carers. So this really focuses on the individual. So looking at that EHCP process, it is sort of aimed more broadly than that. It does draw on the EHCP process a lot, but we are aware that there are children and young people with SEND who have a plan that involves outcomes that isn't an EHCP. So it's a little bit broader than that. We think about what an outcome is and what an outcome means, sort of why they're important for that child and young person, but also helping to unpick and understand the difference between what a parent carer might want to see for their child and young person and what that individual wants to see for themselves. So helping us to understand and differentiate between those voices and how we can really understand our child and young person's perspective. There are some nice tools and examples of ways we can understand, including those who are non-verbal. We then have a look at the golden thread and how that runs through any plan, sort of from aspirations through to provision, going via outcomes, and how professionals support around this package and sort of system. There is a quick look at strategic outcomes, because I think it's important with these quite significant shifts that are going on at the moment that parent carers have that understanding as well, because that's how we look at the bigger picture around the child and that sort of don't want to say political environment, but that sort of context that child is receiving their support in, and understand how that fits in with their individual experience. The professional version, on the other hand, is sort of the other way up. It starts thinking about the strategic outcomes and what that means as an outcomes framework, and then how that filters down to the individual. Again, there's a lot of clarification of terminology there, a lot of understanding what the difference is between outcomes and outputs, difference between outcomes and impact, and then how we sort of use and bring those outcomes to life in our commissioning cycle and in our commissioning decisions, and as I say, how that links in with the different levels. So looking at that bigger picture and how the outcomes-based approach ripples down through our system. So these are, I think, just about to come out, and they are designed and ready to go. And again, please do make use of them. Please do share them with your colleagues, and we'll be interested to hear how people are using them. I think that's everything from me, Anna.
Lovely, thanks, Philippa. We do have a few minutes before I start talking about some of our other resources for any questions or reflections. So do pop the questions in the chat or take yourself off mute. Yeah, Natasha, the PDF documents, actually, Philippa, in doing these slides, they're on the website already. So we can, for the outcomes explainers, they're there, and at the end of the slide set, there'll be a link, which we'll share. And we'll share all the slides anyway. So any other thoughts? You know, we've had lots of testing around e-learning and some really good feedback on that. So all good there. I'll give you a couple of minutes just to the seconds to type anything if you want to, and then I'll move on to some of our other things. Amanda, your hand's up.
Yes, I was just wondering with the training, the e-learning, whether you can start it and then stop it whenever you like.
Yes, it's completely self-guided. Each of the modules takes about 20 minutes, so you can either sit down and do a block if you've got the time to do so. If you want to dip in and do 10 minutes, come back later, completely fine. Everyone needs an individual login, which again is free to set up, and then it records your progress as you move through.
Brilliant, lovely, thank you.
And looking into next year, we're working with in the Southeast around some more, I suppose, bespoke e-learning approaches, and although that will be developed with the Southeast, I think the intention is that will be available. So I think there's more work happening around this as well, and it's something that we'll want to kind of adapt and tweak as things change. Now I'll talk more about the sort of policy landscape that might be changing. Sarah, it's the Southeast region NHS, so it covers the whole Southeast NHS region. Again, it's work that we haven't quite yet started, so I can't give you lots more detail about that, but Philippa will be involved in that and is our guru and all things here, so she'll be able to help as soon as we know more. Okay, I'm going to just talk you through. Oh, Amanda, your hand's up again.
No, sorry, I just wanted to say
thank you for
those pieces of work, because it saved us DCOs an awful lot of time. and also having all those resources available to parents whenever they want to be able to access them is just really good. So thank you very much for contributing for that. It's great.
Yeah, well done, Philip. It's a really great piece of work. Okay, so I'm going to talk us through some slightly differently pitched resources. So our contract is fairly broad. So we do lots of the things that Philip has just talked about. We also work strategically in local areas to help them get their, I suppose, to work in an outcomes-based approach to commissioning. Now, the diagram that you can see, I guess, is the stages of developing an outcomes-based approach to commissioning. What we have done in the last year and are hoping to do in the next financial year through the same contract is work with local areas, some of whom who've had an inspection have a written statement, or others who maybe haven't been inspected or were inspected don't have a written statement but have identified some areas to make improvements. We can essentially develop a session, do some work around each sections of this diagram. So that diagram is where, at the end point of that, you will have an outcomes-based commissioned model. What I would say is lots of areas aren't quite at the end of that, but we've done a lot of work this year with lots of areas up to about the kind of middle teal arrow moving into the orange. I will tell you a little bit about some exciting work we're hoping to do next year, where we'll go up to the very end of that with an area and develop some resources to help others do that too. But that is the kind of backbone to what I'm going to talk you through in terms of how the resources that we've developed to help with that outcomes-based approach. Yes, presentation will be sent out. We'll get you the slides. So Camden is an area that we developed a case study on a couple of years ago. So that I'm talking about the case study that exists, and then I will talk about a kind of beefed up version of that case study that we're about to publish. So Camden have an integrated SEND service based on an alliance model. Now this has been a long process for them, I think 7 years at least, since they started this work. So the challenge 7 years ago was that they had lots of providers, nothing unusual, providing lots of community health services, plus their London Borough, their local authority, was providing social care. Unsurprisingly, there was separate data, each provider capturing, some sharing. They obviously came from a place of strength, as well as most areas do. They had lots of providers already working together on the ground, lots of really good collaboration around individual children, young people, again common in most of your areas too, but it wasn't formalised within governance and strategy. They did have a really strong model of collaboration through their Mosaic team, which is where their child development team sat, where some specialist services were, and also a single point of referral. So that was where they were coming from in terms of strengths. So to address the challenges that I talked about, they then jointly commissioned an outcomes-based integrated service, which is now 7 years on, a really strong service. So that some of the kind of key points that we pull out, and there's more detail in the case study that we developed a couple of years ago on this. So staff employment was linked to providers by their profession. So that kind of professional development and supervision sat with one provider around a profession. Central North West London, their Hostel Trust, held the operational lead role within that alliance contract, which meant they maintained the electronic patient record. Performance info sat with them, clinical leadership sat there, but all providers within the contract had shared KPIs, the things that they were all working towards. Now, what I would say is these are KPIs. They're not what we would see as outcomes within an outcomes framework. They kind of sit below that. So they're very easily measured, I guess, what I would say. So there was a KPI around timeliness in terms of waiting list, timeliness for assessment, families experience. So they did collect and measure against qualitative data, multidisciplinary planning, transition planning, and individual goals. So those were the KPIs that all providers had to meet. Those KPIs were linked to financial incentives. So it was in every provider's interest to meet those KPIs. They weren't met unless every provider met their KPI. When they were met, that unlocked a bit of additional investment that Camden then used to support on KPIs that weren't being met. So some really, really impressive impact from Camden. They were consistently meeting or surpassing those KPIs. The incentives that I mentioned when they did meet a KPI then led them to develop more collaborative approaches to turn the other KPIs around and kind of look at further investment, different pathway redesign. Family confidence and satisfaction levels are really high. They also now use a single outcome measurement process, so a goals-based measure. So that's where they are, and that's all. A lot more detail is in a case study, again, we'll share, but that we developed a couple of years ago. Where we've got to now with Camden, because actually we were so impressed with that, and we thought, how do other areas take that learning and make it applicable to their local system, which will look different? You know, Camden, another strength is that it's a London borough. It has a very distinct geography, coterminous with, you know, it was a much easier, it was a very highly populated area, but within a small footprint. So that was a strength, I guess, and a strength that not all other areas would have. But what could we pull out from their learning that would apply to other areas and other areas could take and use? So we've used an implementation science approach, the kind of methodology that is quite often used within health. So understanding how systems, services get to implement a change, you know, what are the steps that they've taken, what did they need in place to get there? So what we have done, and this isn't published yet because it's still being designed to look lovely, but we've used each of these steps that you can see on this slide there and explained what that looked like for Camden and pulled out the things that other areas will find most useful. So obviously started with fertile ground. There were lots of leaders, lots of people that were keen for a change. There was an innovation, an integrated service being that innovation. And we've looked at all of the things that they had to put in place to get that integrated model. So that includes a timeline, lots of information in the new resource around the governance that they needed to set up, what that looks like now, thinking about information governance as well. There's lots of data sharing implications. So we address how they got over some of the hurdles that we might experience in terms of information governance. So it's really a very kind of granular level resource that shows the steps they've taken to get to where they are. There's also a separate briefing around the goals-based measure that Camden uses and a few other examples from other areas, as well as some of our learning from the last year around goals-based measures and how they can be useful, but also some of the kind of common things that kind of sticking points around that. So that's Camden, and that will be ready in the next week or two. And again, because we've got your email address from this session, we'll be able to share that with you as soon as it's ready. And it'll sit on the website. So that is the first kind of strategic level resource that's coming. We've also developed a joint commissioning checklist. So this looks similar to some audit tools that we published a few years ago. So it's an Excel tool, nice and simple to use, fairly intuitive, that enables local areas to RAG rate themselves in terms of joint commissioning. So it's not health or local authority focused individually, it's a joint tool. So it's for commissioners, strategic leads, against 4 themes, and under each of these themes there are prompts for implementation and examples of evidence that a local area might have to show where they've got to. So themes being an agreed vision for all partners, being clear data, clear strategy arrangements and governance, and processes for agreeing resources. So kind of linking back to that diagram I showed at the start as well, of the kind of steps towards outcomes-based commissioning. Also a list of useful resources that are around, linked to all of those themes. It also takes into account the fact that we're in a bit of an interesting time health-wise, but actually has implications for the whole system. So obviously we have a white paper around a new health bill, so it does start to bring in some of the considerations we need to make around integrated care systems and all of the things that I'm sure lots of you are kind of getting your heads around at the moment. So at CDC, we like a challenge. We've heard lots of people talk about integrated care systems and think, oh, what does that mean for us? So what we are again in the process of finalising, so not ready yet, but again in the next couple of weeks, is a very high level briefing. I suppose it comes with a bit of a health warning in that there are so many moving parts to this at the moment that we can't possibly give you definitive answers on anything. And actually, we're not the ones that hold those answers. I think the answers sit with you in practice and in local areas. But what it will do is obviously in light of that white paper that I mentioned for the Health and Care Bill, which doesn't have a lot in there about children, but certainly not explicitly, but implicitly there will be changes to what this looks like for children. So we've tried to, our question that we've posed ourselves is, what are the integrated care systems? Should be easy enough to answer, but what needs to be considered for the children and young people that we all are focused on? So children and young people with SEND, what are the differences? What does this mean for them? We've done a bit of work with our DCOs and DMOs and had an amazing response in terms of the questions that you as DCOs and DMOs have. Can't promise we'll answer all of them or any of them, but it's very much about us bringing that together and starting a bit of work over the next year to help kind of find our way through that new system. So the moving parts that I explained, SEND joint inspections are starting up again, so we want that to happen and to understand what that looks like in a slightly different world. But most importantly, the SEND review, so that really important national review of the SEND system with recommendations that absolutely will impact on us all. That's due to be published in the summer, so we don't want to be starting to think about what practice looks like in terms of ICSs until that's all out and we understand what that means. We know there'll be some implications in the SEND review for the DCO, DMO role, also understanding what that white paper, what the bill, what it'll look like in statute, what that will include, so that the initial briefing will be ready in the next couple of weeks. But I imagine over the next year, through our DFE contract and other work that we do with NHS England and Department of Health, we'll find other opportunities where we can feed into that and also listen to you and hear your, concerns and your questions around that and what that might mean for you. So a starter for 10 is what I'd like to say on that, and again out in the next couple of weeks on our website, and will be emailed to you since you're all here today. Sticking with the strategic, so our data dashboard, again, not a new bit of work. So we've had the Excel tool for about 18 months or so. For anyone that doesn't know, I just a background to that. So it's a commissioning tool that brings lots of data related to children and young people with SEND into one place. It's all secondary data. It's data that's already publicly available through the local authority interactive tool or published in the DFE, published by NHS England. So it's not new data, but it does bring it into one place, and it's all specific to the SEND population and commissioning for that group. In terms of the tool, the idea is that it's shared data across the local area. We can all be looking at the same data, whether that's health, education, social care data in one place. So it really facilitates that holistic approach, and it allows kind of comparisons to statistical neighbours, all the usual things that you would want to be able to interrogate data. The Excel tool does. What we've done in the last year, though, is add some qualitative indicators. So an outcomes-based commissioning approach asks, the big question is, what difference did we make? And we can't often answer that with the quantitative data that we capture routinely. So we've started to kind of unpick, what does qualitative data look like, and how do we capture it? Because it's not the stuff that we're routinely or mandated to capture via DFE or NHS England. It's different, and it's actually up to local areas to capture that and to develop methods of doing that. So I'll talk about that in a second. The new bit of the data dashboard picture is that we've developed it in Power BI. So Power BI is a bit of Microsoft software, really intuitive. It just shows the same data in a different way. It lets you make nice graphs, pull off different reports. So that's finished. We're just doing our final kind of checks over it, and it will sit on our website. What I would say is that you don't need to have a license in Power BI to open it. It will be on our website. You'll be able to download it. You might need to put an update on your computer, or for those of you on local authority and NHS computers, you might need to ask your administrator to do that. But what we know is that lots of local authorities actually do have licenses and pay for Power BI. So it's likely that if that's the case, you'll already have those updates. And if you don't, again, ask your administrator. It's nothing. You're not downloading software onto your computer. It is just a case of having to make a change to open something that sits on our website. So it's very safe and secure. But if you have any issues once it's out, let us know, because we need to be doing some troubleshooting around that. So do let us know. I'm just looking at, Yeah, so Adeline, keen to have more information on this as we're looking at Power BI, particularly around the licenses. So I can, I'm not sure, I know that they're fairly costly, but if that you're doing that as a local area, then actually, you know, economies of scale, that'll be worth it. You don't need that license to open the dashboard that we've developed, but if you have that license, actually you'll be able to do more with it. So that's only got to be good. But again, when we publish the Power BI version, it will come with a user manual and some instructions as to how you can interrogate the data. There'll also be a master version on our website that won't change. So you will be able to, you know, if you open it and you can change things, you might worry that you've changed it forever. It's not. There's always a master template. So have a bit of a play around with the software. It is, I think it's intuitive. It just takes a bit to work out what it does. It does some impressive things. So that's that. But a bit more now about what's actually in the dashboard and what's different. So that diagram there is the journey that I've probably just explained. So 2018, we worked in, with Devon Sustainability and Transformation Partnership, as it was, pre-ICS, to understand what data that local system would find most helpful. So that's what is in the Excel version of the dashboard that we have. Then last year, we developed some outcome statements. So the work that Philippa does in lots of local areas, the work I mentioned around an outcomes framework, what are the sort of I statements that a local area wants to keep front and centre of all of the work they do, how they commission, how they deliver services that show that they're making a difference for young people. So I'll show you what that looks like in the dashboard in a second. Then, as I've just said, we've reviewed the data sets that we have in there. Some, unhelpfully, are about to be updated in April. So we will need to do a bit of an update on the Power BI version in May time, but it will be out as it is soon, and we'll update the data as and when we need to. So those outcome statements that I mentioned. So last year we worked with a national group that we set up around data and information, and we came up with these I statements here. The work that I mentioned Philippa does in lots of local areas. These are the things that all local areas come up with and co-produce. They look slightly differently. The wording might be different, but actually it's the same common theme. And what we've done in terms of the data is, I suppose, recommended some indicators and performance measures that you might be able to capture locally that would tell you, that would show progress or show where you are against those statements, the outcome statements. So some of it is data that exists that you'll be capturing locally, or that you are capturing because you're asked to from a national source. A lot of it, however, is not captured already, and it'll be up to a local area to design ways of capturing that, which is something that we want to work on again in the next contract year. So our intention is that we'll be able to develop templates and tools to help local areas capture this data. And I imagine the shift to integrated care systems will support that, because actually this data isn't health or education, it's a system owned data, and we'll work with some areas to understand how that might be captured. So lots of examples of what that looked like. What we would say though is, because this data is locally owned, actually you in your local areas may well come up with different indicators against your own individual outcome statements. These are the statements that are in the dashboard as it is, and they're to be used within local areas or adapted to suit. So the dashboard that is about to come out in Power BI has some additional data sets added that we've talked to various people and decided actually we need some new data, or there's more data that we could capture. So that's national data around SEND demographics, some additional information on attainment 8. We are also pulling in some additional information from the mental health services data set. We've updated the information from the National Learning Disability data set. We've also included health checks for young people with learning disability. We've also added the community services data set. What I would say there is that actually compliance around submitting to that is still not great. So lots of areas still aren't, or the data is patchy. But we thought it was better to have it in there, and it's almost a bit of a lever that you can use locally if you're not submitting, when that data isn't flowing from local area into the national data set, then it will be clear from looking at this tool. so that it's in there for that reason, not to shame anyone, but hopefully to help encourage more compliance. So that's data. I'm gonna, before I talk you through just where you can find that, I'll give you a chance to ask any questions or post any reflections. I imagine we'll get a lot of questions around the Power BI version of the dashboard, so we're expecting that, we're anticipating it, and we really welcome it, because actually we need to understand how you as users find it. What I would say is I was on maternity leave while a lot of that development work was done, came back, and the first couple of times I used it, actually it felt really good. It was really intuitive, it's really whizzy, it shows the data in a, for me, more visual way, which always helps, and because it's a bit of software, it's not just Excel, which can be slightly clunky. It does things more cleverly. However, the Excel version is still there. Don't worry, this Excel is what you like, it still exists. So yeah, that's our data and our commissioning resources. I haven't had any questions, so I imagine you're all still pondering some of that. So I'll talk you through where you can find what we've talked about. So Philip, I mentioned the e-learning on our platform, which is free to access. You do need to make an account, as Philippa said, but that's only so that we can give a bit of data back to the people that commission us to do that, and so that we know how many people are accessing that, and how, you know, if they're completing it. The outcomes explainers there, that link there, our dashboard, so that link that's on the slide there is to the Excel version. The Power BI version isn't uploaded yet, but it'll sit on the same link. And as I've said, Camden, that roadmap case study is being designed, the joint commissioning checklist, just in its final checks, and it'll be uploaded to the website, as well as the ICS briefing once we've finalised that. So that is the year we've just had. Any thoughts, questions? I will just very briefly, and we can stop recording at this point, Kate. So we'll upload that recording to our website, and it will be a helpful resource for anyone that wasn't able to join. So in terms of next